Now, good afternoon, ladies and gentlemen. I'm very happy and feel privileged to have been invited to this conference. I have just asked for the pointer so that I can change slides. I've got 15 minutes to cover the current challenges in psychiatry, but I'll manage in 10 minutes just as well, since I will merely repeat what we have already heard, which is the, so to say, leitmotif of the prevailing situation now. Well, we are living in pandemics of mental health disorders or conditions, and we suffer from lack of capacities of all the services for persons with mental health issues, whether conditions, disorders, illnesses. And I will just touch upon a couple of measures, and I'll talk about the bottlenecks that prevents us from helping adequately people. We have to focus on capacities building and resources. We must never forget that. And the way out of the current unpleasant, difficult situation ahead of us obviously is in innovation or novel treatments, but innovation as such. I'll talk about prevention as a management of risk factors in the Czech Republic, and this is covered by media. You hear that, you see that, you witness it amongst your friends. There is a great increase in the need for psychiatric care. It's a real avalanche when we compare it to 2019 before COVID. There is a 20% increase of persons or patients diagnosed. Most frequently it concerns children, adolescents, as well as adults, of course. We have got inadequate number of outpatients departments, 60 for children and adults. We have reached 60% level of the foreseen need, but we don't even have adequate services for adults, acute FADs or acute care beds. 42% when it comes to community services. We are even worse off, 30% of the requirements we only meet. There is a worsening regional accessibility and availability of psychiatric care. The result is then excessive pressure on first contact places, crisis centers, psychiatric inpatient care for both children and juveniles or adolescents, pediatric inpatient care, and primary care pediatricians. Two pictures that show or illustrate this increase. Here, obviously, this is the number of outpatients department. 500,000 were treated 2010, and it has been 660,000. This is across the groups, age groups, and children and adolescents, 40,000 versus 63,000. So we don't have, as I've said, adequate capacities or facilities. We don't talk, and these are the patients who were lucky enough to be enrolled for the treatment, and we don't have those who have failed to get access to treatment, plus the number of phones requesting care, etc. We've got in 2019 we had roughly 2,000 contacts in the emergency center. 20,000 looked for assistance within the first contact. In 23, this was 5,000 persons. In this year so far, as of now, it's been 2.5 thousand treated clients. So there is an enormous soaring, simply increase. Just to give you an idea, where are the bottlenecks, as I refer to? We are understaffed. We don't have personnel enough to cover or to provide all the services as planned. If we have something like National Action Plan for Mental Health 2030, and that enshrines or reckons with the network as foreseen for 2030. If you look at it, you can see the number of medical doctors in red, that's psychiatrists. We need 1,354, while we have only got 1,238. There is a gap, obviously, and then acute beds, follow-up care beds, etc. The group, or the aim for the group, is or has been developed in line with the strategy reform 2013, plus 200 psychiatric outpatients department, acute care beds, and psychiatric nurses, which have not been included in the chart or in the slide. Now, it's not only about those the shortage of 100 psychiatrists, but also about the demographic curve as it develops. Demographic curve, active psychiatrists. On the left, you see those orange and red. That's the age composition of our active psychiatrists. We have got 258 who are 65 plus old. It means any time they decide to retire, that's it, and we lose another one. Altogether, 343 is 60 plus years old. It wouldn't be a tragedy had we had corresponding increase in numbers of newcomers or new simply psychiatrists getting into practice. So there is a major increase of those leaving and insufficient number of those entering the professional career or starting practicing. So the situation will be even worse in the next 5 years unless we do something to reverse that. This is the number of new acquired specialization psychiatrists, specialty, post-degree exams, roughly 35% a year. And we are short of 100, as we have said, 258 close to retirement age. 343 will retire, will have retired within 5 years. Obviously, 1/4 of the capacities will be gone of healthcare professionals in the field of psychiatry. And we will have a challenge or a problem to actually meet the demand. Well, I will be even more depressing in my next piece of information, risk factors and mental health in the EU. So what will our population, not only in Czechia, but all over Europe, be exposed to? So, risk factors already identified that hamper mental health development. What are the phenomena in the contemporary Europe, contemporary society? Low socioeconomic status, which is a risk factor, that's more than obvious. Energy crisis, EU economy's performance in relation to Green Deal and automotive industry's requirement. Well, this for sure will play a role. another risk factors related to mental health disorders, loneliness, social exclusion, migrant status. All these are truly mega trends prevailing throughout Europe, covered by media on a daily basis. Psychosocial stress, climate, anxiety, war, societal changes, demographic change, adolescent crisis, which means that they will become mature and they are, so to say, a troubled group nowadays. And also aging population, yet another risk group, neurodegenerative disorders, substance abuse or substance use disorder, SUD. If you regularly abuse marijuana, you double the risk, amphetamines 10 times, and then you get to the risk level as equivalent to having a schizophrenic parent with a mother or father. So, what is the potential of preventive measures? Can they boost the mental health of the population in the long run? Well, can we adopt some sort of preventive measures that would help entirely? I believe we should focus on measures to boost the resilience of individuals. That will mean long-lasting burden or pressure on the services for mental health patients' capacities. We need resources in order to build capacity needed for mental health patient services provision, prevention, social programs, and a way out of this darkness or dark cloud could be innovation or novel. Improve and accelerate the treatment psychedelics, that is to have them included in the pharmacological patterns or drug treatment patterns. It's not a panacea, it's not a cure-all. It's not simply relevant for everyone or with every and any condition. Then support technologies. All kinds of forums supporting communication, supporting the provision of services and uptake of services, e-health to boost or promote mental health. We have to clearly identify those technologies that make sense, that are meaningful, and humanization and quality services. It means that we have to have enough staff, adequate staffing capacity in order to be able to provide human rights based services. Now, Mr. Mravčík talked about legalization, or perhaps I want to talk about THC legalization and decriminalizations. Some colleagues are quite nervous. Mr. Mravčík attended our conference in the month of January and explained why we shouldn't be that nervous. Why are we? What makes us nervous? Well, we believe that legalization differs from decriminalization. Decriminalization is trouble-free, but legalization perhaps is not that makes you feel that it is not that dangerous if the state allows that stuff or substance in the market. So we have to be cautious. THC is a proven risk factor to mental health disorders or mental disorders. And our youngsters, once they believe THC is just okay, piece of cake, why not? When you can buy it in a store and their mums tell them, don't you smoke? So what will they think about it? Perhaps they will go for it. We are afraid that the sick signal might result in the increased consumption of THC unless accompanied by adequate risk communication. And the discussion before lunch made me, or reassured me, namely these risks are being communicated well. I believe we shall launch a campaign. If you are depressed, don't you go for cannabis, cigarette or something. So we have to hear that the regulatory authorities bear all this in mind and will support services that will boost mental health and mental health related services provision. We can only call for an urgent or call to action. Let's simply go for call to action in order to be able to cope with the psychic or mental disorders epidemics, inadequate service capacities, essential or significant risk factors and negative trends. What do we need? Resources, innovation, humanizations. If that is not achieved, then we have to put up with decreased quality or decline in professional care provision. Thank you. Thank you for your attention.